Hooked on Health podcast. I've got Dr. Jenny LaBonte of a practice in West Boylston with us today, and I'll hand it right off to you, Dr. Jenny. Please talk. Tell us a little bit about yourself and how you get into direct primary care medicine.
Sure, thanks so much. So I am a local gal. I went to medical school here in Worcester at UMass, and I graduated in 1997. And from there, I decided to do my residency in family medicine. So I stayed local again. I went to UMass Medical School's family medicine residency program. They do a really good job of training primary care doctors out of UMass.
Mhm.
And so I completed that in the year 2000. And then what I did from there was I joined a small group practice that was owned by one of our large local hospital systems.
Mhm.
And I worked there with a small group for several years, really enjoyed it and built up a practice. And, fast forward 20 years from there, I worked for another large employer across town. And then um, at at that point in my life, 20 years into my career, I decided that I was ready for a change. So I decided to leave that kind of traditional healthcare system, and I basically opened my own private practice. And I'm doing what you already spoke about, which is direct primary care. And along the way, it wasn't like one day I just woke up and said, "Oh, I'm going to open my own practice today." But there was sort of a slow transition happening, probably from about like 2018 onward, where I started to get really interested in um, doing medicine slightly different. I became really interested in the psychology of habit change and helping my patients with some of the big things that we see in primary care, which is often obesity, depression, anxiety. You know, we see so much diabetes. And I really felt like the traditional healthcare system did not give me enough time to spend with my patients so that we could really break it down and talk about what was leading to some of these health problems for them. And so I became really interested in things like health coaching, and I went off and I got my certification in health coaching. And I also became really interested in something called lifestyle medicine. And lifestyle medicine is essentially just the endorsement that a lot of our ailments can be prevented or cured with paying attention to six main pillars of health, which are exercise, nutrition, quality sleep, healthy relationships, avoiding toxic substances like tobacco and alcohol, drugs, and stress management. So, as I got more and more interested in these things, I really wanted to try to develop a practice where I could really fully engage in all of these elements and take more time with my patients. And direct primary care allows me to do that. So that's how I sort of got to where I am today.
I think that's incredible, and I think lifestyle medicine. Jenny, correct me if I'm wrong. Is sort of a newer kind of topic.
Mhm.
In the traditional sense of I guess, being, the medical doctor field. So tell us more about, the history behind that and, prophylactic care.
It's interesting. The first time I heard of lifestyle medicine was probably back around 2018. And I went to a really large national conference down in, I think it was in DC. And they had invited people from all different types of practices. It wasn't just doctors, there were nutritionists and health coaches and um, nurses and physicians. And so they invited people of all different types of specialties to really embrace the idea of lifestyle medicine and incorporate it into their practices. And it was really, really interesting. And they really heavily emphasized plant-based or plant predominant diets. Really talked a lot about like what helps people age well, what factors have they found in the research that helps constitute longevity. So there was that was kind of a big eye-opening conference, and I loved it. And interestingly, that uh, field then became an actual board, like a medical board. So you can get board certified in lifestyle medicine, which is really neat.
That's really cool. I like that. Now, is that something you've done yet, or is that something you're planning on doing?
It's not, I didn't really feel like I needed to have the board certification in order to embrace the concepts and teach them and, live them out in my practice. So yeah, I just sort of utilize all of the tools and pass it on to my patients. And I feel like it's a really valuable standpoint.
And for our listeners, a board certification is a specialty medical exam that you have to sit for at a test center to prove that you can speak, on the topic, at a quote unquote competent level. And
That's right.
What Dr. Jenny is saying is that the concepts of it are I think concrete enough that she, feels comfortable talking on it and, embodying, um, you know, being able to speak about the concepts and going from there. But so you said something really interesting, about the anti-aging and all, basically all of that stuff, right? So I think that that's a hot topic, obviously, for the boomers and any 50 really, I mean, I would say 40 plus, patient of mine out there. So can you talk a little bit about what you learned, from either that conference or just in your career about how people can age gracefully and age in a more healthy way?
Was so interesting. I went to this lecture at that conference that talked about something called the blue zones. And I don't know if that's something you've ever heard of, but apparently there's these hot spots around the world where they find that there are a large number of people living into their hundreds. And so researchers went there and they tried to figure out what is the magic potion that's allowing these people to live longer. And one of the really interesting things that came out of it, it wasn't just that these people were eating like fairly wholesome, whole foods. A lot of these people didn't have access to super high healthcare. A lot of them were, living in Asia or maybe third world countries, but they seemed to have very strong connection with their community, which was interesting because that's one of the pillars of lifestyle medicine is sort of a sense of belonging within a community or having healthy relationships. And I thought that was super fascinating. It wasn't just like you're, exercising your brains out or something, that these people were living longer because they had a sense of purpose. They were sitting down with their peers and having engaging conversations. And so it was stimulating their mind and their spirits. But beyond that, I mean, some of the advice that I give to my own patients in terms of longevity is I really think that staying moving is so important, staying exercising and fit, and that may look different for each individual, but having some sort of, regular daily movement is so, so important and really keeps both the mind and the body healthy.
Yeah, I think that's I think I'm a little biased, Jenny, because I'm a PT. There's a lot of research that I've read, when I was doing, I did one of my papers when I was graduating on multiple sclerosis. And there, interestingly enough, to your point about the blue zones, there are zones where where MS is just non-existent, basically, in the world. And it's pretty much right around the equator. And so when they dig a little deeper, they still don't really know why it's non-existent around the equator, but it's super interesting to me, as an aside, just, the different variables that go into, longevity, right? Because, like you were saying, some of these, areas in Japan or some of these tribes that you look at and they've got centenarians like all over the place or non-genarians. And it's like normal, it's a normal part of their culture, and they don't have access to whey protein and plant-based protein and multivitamins, right? And I think that the community piece is something that, and I'd love for you to talk about that a little bit, where you find community and, where you tell your patients or suggest your patients find community, because I feel like often we're now looking and finding community on Facebook and on, social media when, that's just not necessarily a great way to create a healthy, a healthy, you know, a vibe. So could you talk
That's
to
right.
that a little bit?
Yeah, absolutely. I mean, I think that one of the things I really like to emphasize to people is, that everything is uniquely and individually tailored. I don't have like a one size fits all approach. So for one person, community and sense of belonging might mean that they're really linked in with their church. Or for another person, maybe it's that they have like their band of best friends that they, go out for drinks every week or something. It really just depends what somebody's interests are and where they feel like they have. I keep coming back to the word purpose, but that's really important. For some people, purpose is interwoven with spirituality, but in some it's more woven into their job that they do. And we see it a lot of times in retirees. They really need to still have a sense of purpose, and many people wind up finding other interests or hobbies or even a second job after retirement. But that is one of the keys to getting up every day and having some structure and uh, you know continuing to have a reason to live and want to keep going. So I think it might look different for each person, so I don't have like a specific like advice that I tell somebody to go hook up with X, Y, or Z, but I really think it's important for them to search their heart and see what do they feel pulled towards.
Yeah. What is your purpose, Jenny?
Mm. I'm a very like multifaceted person. And so I think I have a lot of different interests, and my purpose probably changes depending on like what facet you're looking at of me. But in a work world, I think I really feel, it's funny that the name of my practice, it's called Inspire Family Medicine. That really hooks deeply into part of my value system and what makes me tick, which is to inspire other people to be their best. And sometimes that is like patient to patient, but it also has to do with how I interact with my colleagues. And that's always been sort of who I am. I really enjoy like cheering other people on, sort of walking the journey with them. And I don't know, just seeing the best sides of them come forward. So that's a lot of what my purpose is.
Yeah, I think that's great. I think, it says a lot, to break away from a large hospital system and start your own business. And, I mean, that your purpose, I'm sure you don't do that without a purpose, right? And I think that to inspire others to live, better lives is, is a great place to start, and
Mhm.
I think as providers, Jenny, like it gets difficult when you're in the grind, and you're treating patients every, you're busy and your days are busy, and it gets, sometimes we lose focus of what we're doing it for, and I think that that's to reflect and to remember, for me, it's, my patients are my community, and when I tell people that we onboard and I talk about our company and I talk about how we're growing and our footprint is growing and we're expanding, I talk about all of our lives that we're touching, right? Like the reason I started Concierge was to affect more lives, and to bring, my vision of what, great PT is to as many people as possible and sharing that with as many families as possible. And, I think that that's what makes me tick. And I think that that drive and that, your innate ability to, to inspire people is, you know it's just one of those things that, you just constantly have to remind yourself, like, hey, you know this is what I'm doing it for, is to help people. And
Mhm.
I think that's great. So let's talk a little bit more about your practice, Jenny. So um walk me through, so it's, and we like, the pricing and all that stuff aside, like walk me through a regular, you, a regular, like, who is your perfect patient? I guess let's start there.
Well, it's funny. I used to think about that, and I think that a lot of the people that come to see me do really value their health because in direct primary care, it's a business model where the patient pays the doctor a monthly fee to belong to the practice. So, on many levels, they're investing in their health just by joining the practice. So, I feel like that's a really important thing because in the past, I may have had patients who didn't care that much about their health and they would arrive at my doorstep and maybe have an expectation that I was going to just fix them with a pill or something like that. So here it's more of a partnership, right? They're putting skin in the game by paying their monthly membership fee. They're saying, hey, I care enough about, you know, having this doctor relationship that I'm going to actually invest in this. And I think that there's some value to that, right? And so I don't know that there is like a specific avatar in terms of my perfect patient. Uh, I really do have a strong female following. I think that if you looked at like the spread of ages and genders in my practice, you're going to see a peak of probably women in that like 40 to 55 age range. And I don't know if that's just because they relate to me and I'm in that same age range, or if that's just those are the people that are seeking a lot of healthcare, that they're the decision makers in healthcare. But I love variety. And that's probably a lot of why I went into family medicine is I just love seeing like cradle to grave in terms of the age groups. I get tickled pink when I have like a 3-year-old come in and, talking trucks and dinosaurs. And then, later in the day, I could have somebody who's like 96. And I love all the different age ranges. So there isn't really one specific perfect patient. I think it's more of an attitude. It's somebody who's showing up who enjoys and really values relationships, enjoys talking and spending time with their doctor. I'm like a very relationship based person. So I think that comes out from just talking with me. And I think the people who like that are drawn to me naturally.
Yeah, I think that's great. So I think so what I'm hearing is that, you're signing up for a relationship, right? And
Yes.
you kind of, it's not just that once a year you check in with your doctor and, it's sort of, probably I'm sure you check in with your patients a little bit more than once a year. What does that look like?
Yeah.
Yeah.
So, what's nice about the direct primary care model is that when people are paying this monthly membership, I don't put any restrictions on how much or how little they get in terms of care. So, I just tell people listen, you have unlimited visits, there's no cap on that. And it all kind of washes out. So, some people take advantage and they see me every month, and some people hardly ever come in. I sort of leave it up to them.
Yeah.
But uh, I think that really what it gets down to is one of the things that's great about direct primary care is that the doctor usually has a much smaller patient panel. So that affords me better access to the patient. So, if somebody calls, like for example, I had a patient texting me earlier this evening and she said, hey, I really have an urgent problem. Can I come and see you tomorrow? And I quickly checked my schedule and I said, yep, why don't you come in tomorrow at 10:30? And there's just such an ease of communication. And I think that's one of the things that people get. That's a huge benefit is that typically we're giving patients ways to text, call, email at, reasonable hours of the day and, be able to get straight through to the doctor and get an answer pretty quickly. And I feel like that really removes a lot of the hassle out of healthcare that so many of us deal with on a regular basis and creates a lot of frustration for people. So that's one thing that I love about this style of practice is just being able to remove that frustration piece for people. So yeah, I mean, there's lots of benefits. I could go on and on, but those are some of my favorites.
Yeah, and I can, easily tell you from a frustrated customer sometimes, and because I go above and beyond to, try to accommodate people. I'll come in early, I'll stay late. And, if there are evals that, it's a post-op or something, I'm always, available. And so in turn, I expect the same from my physicians, and
Yeah.
that's not a realistic. I've come to realize, Jenny, that that's not a realistic expectation. But we've got phenomenal physicians, and that we know and that we use. But it is nice to get, to be able to text a physician and for the physician to respond and not get, and nothing against like a nurse, but like they're not, sometimes you want to have that one-on-one conversation with the doctor, and not because you have the relationship with that person. And it's nothing, it's not belittling the nurse or any of their knowledge, because nurses are like what healthcare is built on.
Yeah.
But sometimes you just want to talk to the person that you talked with the last appointment you were in there with, and build on that conversation, and I think, and again, just relationship based. What do people do, Jenny, if they need like MRIs, X-rays, blood work? What do they do? And do you send them somewhere that they can use their insurance?
Yeah, actually we do. So there's a couple of great options for people when they work with us. One is that I'm always on the hunt for cost savings for my patients. So, for example, a lot of people that come to me have high deductible healthcare plans. And so it's less expensive for them to pay my monthly membership fee than for them to see a traditional doctor and have to pay out of pocket all of the, you know, maybe office visit costs until they hit their deductible. So I'm always on the hunt for low cost options. And so I have my finger on the pulse of some great radiology options for people here in the Worcester area. And I also have really, really great wholesale lab prices through Quest. So that's a wonderful feature. So, a lot of times we'll see inflated prices in the traditional healthcare model. Like if you went to get a cholesterol level drawn and your insurance paid for it, it might cost around $100 or something. But with some of the wholesale prices that we've been able to contract, it might cost you $9. So it's a huge difference. Now, if people want to use their insurance, they can. It's just like regular care. If they went to see, if I referred them to a physical therapist or a rheumatologist, they would use their insurance in those scenarios. But when they come to see me, we would, not use their insurance at all. We don't bill their insurance company. So it's a pretty great deal. I mean, we're saving the insurance companies a lot of money. We're saving the U.S. healthcare system a lot of money because we don't have the same inflated prices, which is fabulous.
Yeah, it's that's a conversation for a different day, Jenny, because I think it's the insurance
Yeah,
companies that are getting rich, not the providers. But that's a whole different conversation for another day.
that's right. That's right.
But yeah,
You
so,
know,
what's that?
I was going to say in a lot of states, they will actually allow direct primary care doctors to dispense medications right from their office. And doctors have the ability to order medications wholesale price. So we can get, common generic medications for way cheaper than Walmart or Price Chopper, or cheaper than GoodRx. And so a lot of patients get to have, their regular prescriptions for a very, very inexpensive price. Now in Massachusetts, there's some laws that they don't allow medical doctors to dispense prescriptions, but in other states they can, and that's a great benefit.
Yeah, that's awesome. And I think probably more so too, Jenny, in like the rural areas where there aren't pharmacists, or I think that's a
Right.
great thing.
Mhm.
But yeah, so I think, tell me a little bit more about, so who you partner with, like what do you, and sort of like, I guess, what do you love most about doing what you're doing now?
Yeah. So in terms of what I'm doing now, I've been slowly building, I guess, a collective of practitioners in my office that really sort of play out this whole idea of lifestyle medicine, sort of bringing it all under one roof for the patients. So, one of the things that I found we had the greatest need for in this area is mental health services. We just don't have enough mental health counselors, psychiatrists, et cetera. And we see so many mental health problems in primary care that I felt like it was really important to bring a counselor under my roof. So I have a fabulous counselor. She works in my office a few days a week, and I can really easily link my patients up with her. And then we also paired up with a nutritionist who is working out of the office one day a week, and she's been doing nutrition consults for my patients, and that's been really lovely. And so I've continued to keep an open mind as to like what's next. If I'll pair with somebody who's doing health coaching, or I really enjoy collaborating with people like yourself in physical therapy, and just giving all of my patients the avenues, making it an easy handoff to meet with some of the other really talented practitioners that work in this area and can help them to reach their goals.
Yeah, just kind of, trying to fill a referral for each of the 6 pillars, right?
Yeah, absolutely. I'm still looking for like a sleep specialist that, isn't somebody who's necessarily, doing sleep studies, but more behavioral sleep medicine. I feel like that's a really important thing, because a lot of people have trouble with insomnia, but I don't want to just turn to pills and prescriptions, but there's a lot of research showing that cognitive behavioral therapy makes a big difference with sleep. So things like that. Stress reduction. I've made some good connections with people who do meditation teaching, things like that. So yeah, it's exciting. There's a lot of areas where I'd love to branch out, maybe get a massage therapist to work with and help people relax a bit more.
See, we'll just have to buy a mansion somewhere, Jenny, and then we'll just put, a different specialist in every room. How about that?
Right? Yeah, we're just trying to give like a whole new meaning to primary care.
Yeah, like
You know,
a canyon
really
ranch,
pleasant experience.
a canyon ranch in Central Mass. Uh,
Exactly.
so, I think what you mentioned, and I really am such a fan of the lifestyle medicine, and it sort of, it follows my philosophy, which is looking at patients as a whole person. And
Yeah.
when I first got out as a PT, and what they tell you in schools, like, hey, like, don't just treat a knee as a knee, look at their hip and ankle, right? But it really is so much more than just the hip and ankle. And as
Mhm.
you get out and you kind of touch more people, and you feel more bodies, and you start to really not fix people, and then fix people, you start to see some trends, and you really start to look at people as a whole person, and not just their musculoskeletal system, Jenny, but how are they sleeping? What's their nutrition? Is, for low back pain, in terms of how we classify low back pain, depression has its own category in low back pain. And, that's not even, I mean, you're talking about cognitive behavioral therapy is the primary treatment for low back pain for that category. And,
Mhm.
so the 6 pillars are so interesting to me. And this is the first conversation that I've ever had about really lifestyle medicine. And I've seen it a little bit on LinkedIn, but it really it's funny because it kind of hits all the doors of the prophylactic model that really it's where healthcare needs to go. And I think that you see it. I think, hopefully more physicians
Yeah.
will stop being so reactive and start to be a little bit more, you know, just like thoughtful around how we're actually helping people, right? Because you're exactly right. Prescribing the lisinopril and, the beta blocker, it's reactive medicine. And it's, you don't even have the room or the space to have the conversation with folks about how they can, lower their cholesterol or lose weight, right? So that's,
Yeah. It's
I applaud you for
satisfying.
taking the jump and, and go in the direction you're going, because I think it's what we need.
I love it. I appreciate that. And I think doing things like this podcast, you're able to get the word out. And I feel like there's lots of different ways to reach people. It doesn't have to necessarily come in the confines of an exam room. It can happen in the, through a podcast, or it could happen through a blog that you write on your website, or it could happen through one of the things that I've enjoyed doing is we have a YouTube channel, and every 2 weeks, the nutritionist and myself will stand up and we'll do a little cooking video, just teaching people like some healthy, quick, easy recipes. So I find joy in that. And again, it's just inspiring people to think outside the box. And sometimes it happens in the exam room, sometimes it happens outside of the exam room. It might happen on a social media post, but there's lots of different creative ways to, touch somebody's life. And you never know, there might be one small thing that you say or do that has a very profound, cascade of events in somebody's life. And so who knows, that I'm hoping to do those kinds of things for people.
Yeah, I think you're well on your way for sure. Um, one piece of advice for your 18-year-old self.
Mm. I think I definitely would infuse my 18-year-old self with a little bit more confidence to just go for it. If I had, I mean, and it wasn't that I wasn't going for it, but I think I I probably would have jumped and started my own practice much sooner if I had realized how happy I was going to be doing things my way, So I think trusting myself, knowing that I already knew how to take good care of people. And once, the chains were taken off and I was able to do things the way I really instinctually knew how to do, that's when the magic started to happen.
Yeah, that's awesome. I love that. Um, now into you. So favorite concert.
Ooh, well, there's a short story behind that one, but I think I've been to a lot of good concerts, including like, oh, I don't know. Jimmy Buffett was fun. I saw him at Gillette Stadium, but my husband and I somehow stumbled upon like third row Billy Joel tickets one year. And that was a really great concert. Like seriously spitting distance to him. So that was fun.
I mean, that's pretty neat. I love that.
Yeah.
Um, favorite movie.
Well, I would say I don't have like one specific favorite movie. I am a sucker for rom-coms.
Yeah.
And I love comedy. I'm definitely a believer that laughter is the best medicine. So I really enjoy a good sense of humor. So anything funny, anything like Will Ferrell or Elf. We always
Yeah.
watch Elf every time.
I think I've seen that movie 10 times at least at the very least.
Exactly.
Every time I
Yep.
watch that, it makes me want to put maple syrup on everything for whatever reason. Just want to
Yeah.
pour maple syrup on everything. That's awesome. Last book you read.
Ooh. Well, always have a bunch of books that I'm in the middle of reading.
Yeah.
So I'll be like halfway through one, halfway through another. So I've got a lot of different ones. I've got like my beach reading books. So I've got this one series from Ellen Hildebrand, like all her novels are on the beach in Nantucket. So I'm in the middle of one of those. But I also do a lot of like different like business, entrepreneurial reading, a lot of Brene Brown, things like that, sort of like personal development type stuff.
All the fun stuff. We get it that we have to do, but it's enjoyable.
Yeah, it is.
Different
Exactly.
perspective. Um, best tip to age gracefully for your clients.
Yeah. Exercise. Period. End of story.
Yeah, I love that. One sentence.
I'm going to put a little addendum on that is do what you love. Like if you don't enjoy working out at the gym, don't do that. Like if having fun with exercise means that you're dancing in your kitchen while you empty the dishwasher, then that's the magic one.
Yeah, I love that. And to piggyback on that a little bit, I always say, you know, just get out into nature a little bit, go for a walk around your neighborhood. And, I mean, we know there's so much research just about like a walk in the woods, what that does for your
Mhm.
psyche. Um,
Yes, I
and
love walking in the woods.
it's just good for the brain.
My kids, their eyes, they're always hearing me say fresh air and sunshine.
Yeah, like when I was a kid, my parents used to just boot my brother and I have a twin brother, just boot us into the neighborhood and we just ride our bikes and, go play with our friends for hours on end, and, we
Mhm.
had video games and that stuff, but we just, that was a second thought. Like when you were young, you just went out and played, and I think as adults, we lose that fun. I don't know.
You
You
do.
kind of get caught up in in raising your own family and, you kind of lose the, hey, like I could hop on a bike and drive, ride around the neighborhood still. That's not crazy, but you could also just go for
Yeah,
a walk. But I totally agree. Find a hobby and do something you enjoy, and it's never going to feel like
mhm,
exercise. Um,
exactly.
awesome. A one sentence mantra that you live
Mm.
by.
I love this one. It's called Small Hinges Swing Big Doors.
Awesome. I like
I
that.
love that. I feel like it, I figured you would. You can kind of apply it on lots of different levels,
Yeah.
both from a physical standpoint, but also mentally, when you think about some of the things and the tips that you give to your own patients. I know I'm oftentimes telling them, baby steps. Like that's how we create strong habits. It's like building upon baby steps. And so I often say, like, remember those small hinges will change. When you make one small little change, that's going to change the trajectory of where you're going.
How long do you think it takes to create a habit? I ask this to everybody.
That's a good question. That's one of the books I'm reading is Atomic Habits. That's a big bestseller. I think it depends. It depends on how big of a change you're making. So, I think the research and the studies have shown that if you're trying to make like a massive shift and you're like doing something that's complex with lots of different steps, that is going to take a lot longer to solidify than a small baby habit. So that's why I really like the concept of like stacking, baby habits on top of each other slowly. I think you're going to get where you're going a lot faster than if you try to like take on some enormous, complex, new, totally different, lifestyle or something.
Yeah, I love that. And for our audience, what Jenny is saying is, when you stack a habit, it's like you take a shower in the morning and then you brush your teeth, right? And then maybe you take 2 weeks doing that if you didn't brush your teeth before, and then after that, you go downstairs and you take your multivitamin, right? And you add that to the mix. So that's stacking. Um, James Clear, I love that book, and I think there's so much great research in there. And I think he settles on around 55 days. And I kind of go back and forth. I think that you're exactly right. It just depends on what you're trying to do. You're trying to quit smoking. 55 days is not going to be enough. Not that I'm a smoker, but we just know that there's just deep-seated neuroplastic change that needs to happen there. But I think for exercise, if you can, work out 2 months in a row and do it at a consistent time and a
Mhm.
consistent, in a consistent schedule, you're going to be good to go and much less resistance there. But yeah, I mean, thank you so much, Jenny, for joining me tonight. I really appreciate it. And,
Thanks
thanks
for having me.
for your time. And, if anybody wants to reach out to Dr. Jenny, I'm going to include if it's okay with you, your email and, the phone number to your practice in the bio. And, it's Inspire Family Medicine. She's located in West Boylston, Massachusetts. It's Boylston or West Boylston?
West Boylston. Yep.
Boylston, Mass. And she is an amazing person and an even more amazing doctor, from what my patients say. So please reach out. And Jenny, thanks again for taking the time. Appreciate it.
You're very welcome. Thanks so much, Sean.
Awesome. Have a wonderful night.
Okay.